Vamos a imaginar un mundo mejor.
Let's imagine a better world thanks to the music. Thank you very much to the musicians, Milena Milutenko, Elena Sheverenko. This wonderful string quartet has been invited to play for us, and we would like to thank them very much for their performance. John Lennon said many things which we should really put into our thinking caps. These four musicians were born in the Ukraine, and we want to express our solidarity to the Ukrainian people at this difficult time. So I'm going to give you a scoop. A Russian helicopter has just violated the Finnish airspace. But fortunately, we are here to celebrate wonderful things and the fact that there's marvelous people in the world. The music has been a source of inspiration throughout history. And now we will begin this award presentation ceremony. We're very happy to have you all. Welcome. I'm very happy to be here, and it is an honor for me. I'm David Cantero. Many of you probably know me. Some of you may know that I'm a newscaster. And, you know, it's a very good opportunity for me to change my routine and be here introducing this award presentation. We are so used to bad news that it's wonderful to be at this ceremony where we're going to be celebrating people that have done their best to improve our world, and this is very good news. The purpose of these awards is to promote initiatives that have a huge social change potential. I'm sure that we are going to be hearing about very surprising projects. And the award winners have come a long way. And the MAPFRE University has worked together with the Ernst Young Foundation. Thank you very much to them. So the great day has arrived. We have 9 finalist projects, and behind them there are very powerful stories. So we will learn from them by the hand of their promoters. But before we introduce them, I would like to ask the chairman of the MAPFRE Foundation to join me here on the stage, Antonio Huertas.
Muy buenas tardes.
Good afternoon. Thank you very much, David, for joining us this evening. And it's wonderful to have you at this event. Welcome to the Secretary General for Innovation, Teresa Riesgo, and thank you to all of you. All of you are friends of MAPFRE, all of you are people that are working around these projects. Innovators, entrepreneurs, and David was telling us about these Ukrainian musicians that have been playing for us today. It's a band that was created ad hoc for this event, and with their music they were trying to express this sentiment of freedom, peace, and also the wrath they feel as citizens of a free country that were unfairly attacked. This is a war that is not just against the Ukraine, it's a war against humanity, and as we have been saying, we need to reject this war out of hand. The Ukrainian people deserve freedom, and the war needs to end as soon as possible. The MAPFRE Foundation has not been oblivious to this tragic situation, and ever since the beginning of the war, we have done our best to help the Ukrainian people. I want to thank the president of the HM Hospital Group, who led a very wonderful initiative a few weeks ago, whereby, together with different companies, they organized a Ukrainian culture festival, and in a very caring way, they organized a fundraiser to gather funds for the Ukrainian people. In addition to this, MAPFRE has also organized other fundraisers and other campaigns apart from what we're doing together with the Spanish entrepreneurs organization, trying to help the Ukrainians who come to our country find a job as soon as possible. This is a very big challenge, not just for the public sector, but also for the private sector. I'm sure that private citizens can do something, all of us can do something to help the Ukrainian people. It's just a question of looking around us and seeing what we can do. But changing gears, we are here today at a time that I consider very touching. It's 5 editions already of the MAPFRE Foundation Awards. 2 of them were held face-to-face and 2 were held remotely, and this is the 5th where it's really a tie-break. And in this hour, we will be able to hear about a lot of initiatives that have to do with social entrepreneurship. and innovation. Traditionally, we see innovation as a process whereby some nerds, normally young people, get together in a garage and start inventing things which tend to become unicorns, and then they strike it rich and they vanish from the face of the earth. Of course, there's been many cases like that which have contributed to the progress of trade, industry, and services, and any of us as users, can attest to that. These daring innovators did something to accelerate the transformation, but what is really even more true is that part of that entrepreneurship is devoted to social purposes. The other day I was at a function where awards were also given to female entrepreneurs, and there were 20 entrepreneurs in the room, 15 of which were trying to resolve social issues which affected quality of life, equality, inclusion, and particularly in areas where unfortunately people do not have access to a welfare state. There's many countries where people don't have access to a welfare state. There's countries that can't even be labeled emerging countries, where people are doing their best to change things in a different way, in a faster way than usual. They, of course, cannot take the same steps that we have taken, because if they did, they would never reach their goal. So anything that is related with the breaking down barriers should be promoted. And social innovation is one of the most powerful game changers, because it is based on the work of people who are aware of the reality they live in, and they just want to change it. Of course, they may make a lot of money in the process, but fundamentally what they want to do is resolve situations which in many cases those same people have been affected by, for personal reasons, family reasons, or just because they have the knowledge of those situations. And at the MAPFRE Foundation, we have been organizing these awards for 5 years, and we are convinced that by making an effort to make all of these innovation processes visible, we can help these people so that they can resolve the problems that affect them. There's 9 finalists. There's 3 categories. One of them has to do with digital health, the other one is prevention and mobility, and the third one has to do with the aging economy. And for those categories, well, there are 3 finalists in each of those 3 categories. As you know, the process, well, we have been joined by the EA University in this process. They developed a whole process in our 3 headquarters. One of them in Brazil, because of the sheer dimension of the country. And then the second one is Mexico, and the third one is Spain. And there's an important novelty for this year, because we're going to be incorporating another geography, which is the United States. We're going to be opening a headquarters in Boston for the next call. The important thing about participating here is not for you to get to know this project so much. I'm sure you all know about these projects. But the important thing is for business projects to be formalized so that those innovations can be implemented in real life. EA is helping us in this endeavor, and all the finalists are going to be joining the Innova network, which is a network sponsored by MAPFRE, which will, support their work. And of course, there's an economic prize connected to this award. And, this amount of money, of course, will come in handy to the winners. Right. So before I conclude, I just want to say that this is not just one more thing that companies have to do. Of course, we could still be a good company without organizing these awards. But in MAPFRE, we are very clear that all of these things are necessary. Because, each of us has a duty. And I was talking about the Ukraine, and as citizens of the world, we need to make a contribution and raise our voice. And also in the area of sustainability, it's important for us to help people without demagogy, without populism, without highfalutin messages, but, knowing the society we live in, we should help bridge the different gaps that exist. In our case at MAPFRE, we're very clear that this should be our mission. We have our foundation, which has worked very hard during the COVID-19 pandemic. We have reinforced our logistic and support actions in over 30 countries where we have been working to strengthen health systems and COVID prevention systems, and also in our day-to-day. Padre Angel is just one example. It's people who we work with to develop our activities, and this is something that we will still be doing. And I want to anticipate, I want to say that MAPFRE has recently been selected as an intermediate organ for the management of European funds. We feel very proud about it. It will be made public once we sign the relevant agreements after the summer, and this is going to allow us to extend our actions and execute our social projects. So before I conclude, I just want to congratulate all the people that have participated. We've had 402 organizations that have helped us. There's been 222 innovative projects, 222 groups that have submitted their projects. There's 9 finalists, and there's going to be 3 winners. I think that all of them should be congratulated, because the effort of incorporating them and encouraging them so that they can be successful with the social innovation model is very significant. That's why congratulations to all of you who have participated. Congratulations to the winners. And, all finalists, I think, could be considered to be winners. So thank you very much. So without further ado, I will now give the floor to the next speaker. And I also want to congratulate the jury and the members of the jury that have selected the best projects. Thank you. Thank you very much. Thank you, Antonio Huertas. Now I will remind you of how these prizes, these awards work. The call focused on 3 strategic regions: Brazil and other Latin American countries, Mexico and Europe, in different areas: prevention, mobility, and senior economy. The 3 winners, each of them belongs to each of those categories, and they will receive an award of 40,000 euros each. The jury hasn't had an easy job. They have had to analyze lots of proposals, all of them with viable, inclusive, sustainable solutions which address concrete needs and offer development opportunities, but only 9 of them reached the final stage, and those have been the most disruptive projects. And social transformation is extremely important. The jury has selected projects that, in their opinion, have the greatest potential for social change and the most viable ones. They have also considered the experience of the group members and, the fact that the project and whether projects were put to the test. Because what we want to know is whether those projects can really be put into practice. But the time has come to get to know our 9 finalists. We will start by the category of improvement of health and digital technology. The incorporation of new technologies to the field of health has allowed significant advances in the prevention, diagnosis, and follow-up of patients. Thanks to that, today we enjoy higher life expectancy, better quality of life. We feel more secure when we need assistance. Also, technology applied to health helps us get to know our lifestyles better and allows us to control certain diseases. With this category, the idea is to promote initiatives that contribute to these areas, improving healthy habits, diagnosing conditions, and the safety of healthcare processes. From Brazil, we have Epistemic. The mission of Epistemic is to improve the quality of life of people with epilepsy and their relatives. For that, they have developed a system with 3 elements. First of all, a portable device capable of predicting epileptic seizures that warn relatives 30 minutes before a crisis appears. I will drink some water because I'm getting rather thirsty. The second is an app. It's a kind of diary where, in a very simple and intuitive way, patients can inform about how they feel, the crisis they experience. And the third one is a web platform so that physicians can look at all the information about their patients and so correlate different triggers for epileptic seizures. In this video, we will better understand what epistemic means.
¿Cuántas veces la humanidad?
Humanity has fantasized with anticipating events. This dream has come true thanks to science. This has been our purpose at Epistemic for the last decade. We have created a triangular system to improve people's lives. This is a device that epileptic patients can use to predict their seizures 30 minutes before those seizures appear. It's an app which allows patients to register their evolution, and a website where all of that information is available to specialists so that they can follow up patients and provide an accurate treatment. We work to reduce uncertainty and increase patients' independence, so that they can go back to swimming, driving, riding a bicycle, and enjoying their lives. That is our purpose. So we have the CEO of Epistemic, Paula Gomez, with us. Could you please join me on the stage, Paula? Thank you. Congratulations. I'm going to ask you a couple of questions. But, predicting the future has always been a dream of humans, but now it seems that you have made it possible. For a very specific case, such as the treatment of epilepsy, what is the origin of epistemic? Well, everything started with my mother. My mother is a physicist, and She devoted most of her life to studying the theory of chaos. And then she was called to a hospital in Brazil called the Syrian Lebanese Hospital to give a talk on the matter. And discussing with physicians, she became interested in studying the ECG signals of patients with epilepsy. After some years, she managed to develop a methodology, a mathematical calculation in order to detect small abnormalities in the ECG signal before a crisis. And that was a huge innovation in medicine, being able to predict seizures. At that time, I had obtained my MBA, so I encouraged to open up a small company to try and implement that idea. Right, wonderful. Some people say that you can't predict the future, you just change the future. And a tool like this one may be very useful for many, many people. It's a huge responsibility. What do you think the impact of this tool may be on patients with epilepsy? Well, there's 50 million people with epilepsy in the world, according to the WHO. And the distribution of those people is not the same. 80% of people affected live in developing countries, and treatment in those places is precarious, and there's not much information. So there's a lot of prejudice around. People with epilepsy tend to be afraid of suffering injuries during a seizure, and this limits their activities. So this can help them get rid of that fear, right, of developing a seizure. Yes, exactly. So the patients and their families have a very high level of stress. Parents say that they can't sleep at night and they're afraid of leaving their children alone or at school. And so patients become excessively dependent on their caretakers. So our company was born to mitigate those problems, because if you know when a seizure may occur, people can go back to the activities that they had abandoned, and they only need to stop when they get this warning that a crisis, that a seizure is coming. Thank you very much, Paula. Thank you. A big round of applause for Paula. Well, now we go on to the next project. But we're still in the Americas. From Mexico, we have Ana. It's a software platform that helps caretakers serve patients better, because many times people lack the necessary tools to take care of patients. This is an app that helps caretakers and patients alike. Let's watch a video that will explain this.
Somos una sociedad con una esperanza de vida cada vez más elevada. Los cuidados en el hogar son más necesarios y las personas dedicadas a ello más numerosas e importantes. En Ana, entendemos al cuidador de pacientes en casa como el elemento central para mejorar su calidad de vida. Empoderar a estos cuidadores es nuestro trabajo. Facilitamos el acceso a formación para profesionales.
We facilitate access to training, receiving help, and paying these caretakers a decent salary, because caretakers are the ones that accompany patients, that take care of patients. So what drives us is people, and thanks to the virtual support provided by our app, we can ensure patients receive a professional support. what we do is we take care of the people who take care of others. That is our vocation. That is Anna. And of course, I was saying we have the CEO of Anna, Ariel Silverstein, who's going to join me on the stage.
Buenas tardes, Ariel.
Hello, Ariel. I'm going to ask you a couple of easy questions. So the work of caretakers is comforting, but at the same time, it's very stressful. So an approach like this one, like taking care of the people who take care of others, is very important. How did this project come about? Well, thank you very much. I have been a social entrepreneur for the last 15 years. I started when I was 25 at the World Economic Forum. They gave me the possibility to start my first project. And so, I started off right at the beginning. 8 years ago, I had to see my mother look after her mother, who had dementia. And I realized that the problem of a caretaker, of somebody who has to take care of a family member, well, it's that this is a very tiring job. And very often, caretakers do not have the right conditions to do their job, and they can't have their own lives. At the same time, I went to Palo Alto to study and to participate in their Singularity program. And at that program, they were saying that people are going to live more and more. We're going to live to be 150, and who's going to take care of us? And that's how we started off. We created a caretaker agency. We talked to tens of thousands of caretakers, family members, insurers, trying to understand in depth what problems needed to be resolved. And that's how we created Anna. First of all, it was a platform that we used for our agency, and now it's a more general home care platforms. Families are never prepared to face up to a situation where a family member needs to be taken care of. And sometimes they have no skills. And Anna, you also focus on this aspect, right? What is the impact that your platform may have? Well, the figures are huge. Now there's 100 million people taking care of a family member at home, but the growth rate is 10% a year. If we look at that, this means that in the world there's over 10 million people who require us, 10 million new people requiring a service every year. And this platform is meant to help caretakers, especially in developing world, in the developing world where caretakers lack the tools they need. So our purpose is to reduce cost and the financial pressure so that patients can be taken care of at home. And, and there's many people who either are in this situation or are likely to be in this situation very soon. Thank you. To put an end to this e-health category, we will talk about Tukuvi. And Lola, they have developed Lola, which is a virtual nurse who is able to monitor the patient's health status remotely without having to use Wi-Fi. The only thing that is needed is a mobile telephone. And Tukuvi is very good because it gives professionals the data they need in order to make informed decisions. If you have a telephone, you have a guarantee of medical care wherever you may be. Lola is a virtual caretaker who will take care of you at all times. Lola will help you get ready for surgery. Lola will monitor you. Lola will provide you follow-up after surgery. Lola will warn your clinical team if she detects that something is going wrong, so that your physician can see to it immediately. We have created Lola with artificial intelligence and natural language processing. We work to make care accessible to one and all. You won't have to worry about using any devices or having internet access. You're just one telephone call away. A telephone call is helping improve people's health. So this is another prodigy. And we have the CEO of Tucuvi, Maria Gonzalez. Please come up to the stage, Maria. Hello, Maria. Good evening. I'm going to ask you my first question. In the 3rd century before Christ, the Greeks already defined the concept of a hospital, but I'm sure that they couldn't imagine Lola working there. So she is a nurse who's the daughter of our time. But how did the idea of Lola came about? How did it come about? Well, the project started 3 years ago for 2 reasons. First of all, I'm a biomedical engineer by training, and I was working in industry, and I realized that there was thousands of patients that were not being followed up when they were discharged from hospitals. So I realized that technology could help take this care to the patients' homes. And also, personally, because of a relative of mine, I had to live many months in a hospital. And there I saw that there were so many things that could be done better, and there were many things that could radically transform the patients' lives. So if the doctor, for example, had had more information before, it wouldn't have been necessary for my mother to go to hospital. So I decided that, technology should be developed so that doctors would have time to devote to taking care of patients. Right, so this is wonderful because technology can help us very much. And what do you think the impact of this idea can be? Well, generally speaking, AI in the health sector can have a huge impact, like eradicating diseases even. And we are helping physicians to be better physicians, nurses to be better nurses, because they will have information to be able to anticipate to whatever may happen. And patients can be less of a patient. They can stay at home. They can have the therapy that is best for them without having to go to hospital, without having to go to the emergency room. So this project is going to transform the way in which, we understand healthcare. Thank you. So we're now going to move on to a category that affects many of us here, because there's more and more people that are getting long in the tooth, so to speak. And, those of us who are getting on still have the hope that we can still contribute a lot of things to the world. The MAPFRE Foundation believes that the demographic challenge is a huge opportunity, but we need specific solutions to improve the quality of life of senior citizens. So what can be done in order to prevent aging from being an obstacle? Well, the idea in this section is to promote active aging, allowing senior citizens avail themselves of different solutions geared at improving the quality of life. Seniors are considered to be people between 55 and 75. The idea is to improve their training and employment, financial education, leisure, free time, and other aspects such as housing, fashion, or the improvement of infrastructures in cities and towns. Let's watch a video. Technology has radically changed the way we do things and the way we communicate. Young people are very good at using technology, but what about people who don't understand technology? We have seen how frustrating it is not to be abreast of these developments, and that is why we created Mais y Vida. We make sure that everybody's needs are covered. Intergenerational communication is very useful. Young people can get their first remunerated jobs, while older people can regain their independence in the technological world. So, connecting young people with older people means a lot to both groups. So, I shouldn't have announced the video. I should have said that this project, Mais Vida, comes from Brazil, which promotes lifelong learning. Young people are called angels, and these angels teach older people the secrets of technology. And now I'm going to call on the CEO of Mais Vida, Lilian Pagadino. Please join me on the stage. Hello, Vivian. I shouldn't have announced the video. Any entrepreneur should be empathetic, but what made you put yourself in the shoes of an older person?
First of all, my grandmother, she's 93 years old now. When, like 5 years ago, 7 years ago, when she stopped working, she felt so sad. She felt so lonely. She felt like she has lost independence. And I was very close to her at that time, and I could see that there is a lack of services for people that retire in any place in the world. There are no enough services to help them, to support them, to live this phase of life, this moment of their lives. So this was my first inspiration, this lack of services. And then some years after, we were doing a field research, and I encountered a girl, 18 years old. Her name is Julia. And Julia was answering an interview, and we asked her, what do you take for your grandma and your grandparents when you visit them? What do you take to them? Do you take a gift? Do you take a cake? Do you take flowers? And she said to me, I don't take anything. I said, why? Why don't you take anything? Anything that she likes? And she said, well, when I go there, every moment, every second that I am there with her is very important, and my presence is more important than any gift that I take. So this was a kind of eureka to me, you know. So I looked and said, there is a way here of matchmaking these two people, young people to the old, because the young people in Brazil, they have the highest unemployment rate. It's like 30% of them are unemployed. So we tried to connect these two people, and it worked. So Mais Vívida is here now.
Idea. Hemos estado viendo en el bloque anterior soluciones relacionadas con las...
We have been looking at solutions connected with healthcare, but we also need solutions for senior citizens, where, you know, the technological gap tends to be quite significant, and elderly people may think that, you know, that society is not for them anymore.
20,000 people in Brazil in our digital channels, and now we are aiming to impact 500,000 people. And the biggest impact, I guess, the legacy that we want to give to the world is that we are changing the age prejudice. We are moving their image, the image that these people have from different ages. So if a young people is having contact with our old people, with the elder ones, they start to see them in a different way. So we are fighting against ageism. Ageism is a very real prejudice. It happens all the time, but it's not talked so much. So if we grow this number, if we grow from 20,000 to 500,000, we intend to impact much more people to understand better what old age is. And we intend also to build the old age that we want to have in the future. So these young people, the ones that are working with us, they are building the old age they want to have in the future.
Thank you very much, Vivian. Congratulations.
Thank you.
Thank you.
Thank you.
So we will still travel through many ideas. Now we go to Uruguay, and we have now also, it's also a platform that promotes lifelong learning for people over 50 years of age, and socialization of not only older people but also younger people. And it's a question of sharing. It's not just a question of receiving, it's also a question of giving. And this video summarizes it very well.
Tiempo para hacer
Loneliness gives you time to do many things, but you don't have anybody to share them with. That is how Maria described her loneliness. But that loneliness is everybody else's loneliness. It's the wish to discover, the wish to learn, the wish to enjoy things never disappears. Or the excitement of, you know, experiencing good times in the company of others. Now is a place where you can get to know people you can share many things with. It's a place where your experience is a tremendous gift. We bring together people of different ages with the same wish to treasure unique moments. A community that fights loneliness with the strength of experience. Now is coming to life. So the jury must have had a terrible, a very difficult job, really, because all these projects are wonderful. Let's welcome the CEO of Now. A few months ago, the Japanese government created the Ministry of Loneliness to deal with the greatest scourge of this century. How did Now come about? Well, the inspiration came from listening to older people. We held hundreds of interviews of people older than 60, where once and over again, people mentioned undesired loneliness, the wish to share things with others. But at those interviews, other things came up. You know, the wish to learn new things, the wish to live. That is what Hector, one of the interviewees, told me. But what does it mean to live your life? For elderly people, It may just be to have the possibility to share with others what they like, and what they don't like. So if you have people that want to share things, and they have wishes, they have interests, what is wrong? What is lacking? Well, what we lack is a meeting place, and that is what now wishes to provide. A second question that's very quick. We have all felt lonely at some point. So how do you think that this proposal is going to impact society? Well, there's a lot of people that are lonely and who do not want to be lonely. And what we want is to promote a new regard. We want people not just to be passive, we want them to be active. We want them to create contents. We want to dynamize relationships, but that capital tends to be bedded by prejudice and by stereotypes. Ageism is very pervasive, and the worst of it is that it is socially accepted. And we believe that this can be changed, and we can build a society for all ages. Congratulations, Inés, for helping people stay in their lives. The last project is a Spanish startup, Cuvu, Home Sharing. It's a social company with the mission of improving the quality of life of elderly people, preventing or reducing non-desired loneliness. The normal thing is for young people to be doomed to share a flat with others. But this doesn't have to be that way. So this capacity of not taking things for granted has led Cuvu to connect elderly people with younger people who may be united by many more synergies than they thought. Let's watch this video. A home is not just a home. It is much more than that. It is the place where we rest, where we shape our dreams, where we find ourselves, where we just are ourselves. In Cuvu, we promote the coexistence between different types of people to build homes. The idea is to enrich your lives by sharing your life with people with completely different life experiences. The idea is to put an end to loneliness. So what we do is we bring people who are akin, we bring them together, we provide them with a meeting place. And they just have to relax and live their lives. That's all they have to do. It's wonderful to have people that are so extraordinary. So we will give the floor to Eduardo Sierra, the CEO and founder of Cuvu. Thank you, David. Those of us who have shared a flat with others know that coexistence with other people is not always easy. So you're very brave, by bringing together people that have such a different view of the world. Well, my grandmother was a volunteer and she helped people who were ill, and I remember I was a little boy, and I accompanied her to a place where she was giving a talk, and So, this helped me change the way I thought. And then, when I was at university, I thought it was a wonderful idea for me to go and live with my grandmother. And I lived with her for 2 years, and she was my best roommate or flatmate. And then I went to Bilbao. I didn't have a penny to my name. I had to ask for a subsidy. And that is when I thought, how is it possible for there to be elderly people who live on their own and who want to share their houses, and then at the same time there's lots of young people that have nowhere to live? Yeah, this is extremely interesting. What you do may remind some people of those apps that people use to look for a love partner. So what impact would you like to have on society? Well, in our case, when we set up our company, our challenge was that we wanted to work on the levers of systemic change around social isolation, but we couldn't do it on our own. We started talking with different organizations around us, working on ageism, trying to promote legislative initiatives. But all of this that we're doing will make sense if we are successful, because when we age, when we become older, we will have tools that provide us with economic stability. So for many people, sharing their home gives them, a wonderful opportunity, and it also gives them revenues, which are so important, because some people live on a bread line, or they receive very, very small old age pensions. So I hope that I have conveyed the gist of our project. Yes, you certainly have. Thank you. And now we will move to the prevention and mobility category. This is the last category of this 5th edition. MAPFRE Foundation works to prevent unintended injuries, especially those in road accidents. So the idea is to promote initiatives that help prevent traffic injuries and all sorts of unintended injuries. We are going to learn about projects that make it possible for prevention to be available to all social segments. From Brazil, we have Lisa. Lisa is a robot that, on the basis of the functions of a guide dog, will allow mobility in an autonomous way for people with visual disabilities. The robot has cutting-edge technology and uses AI to map its environment, and with this help, blind people can function better in their day-to-day lives. When somebody is blind, their autonomy is altered. Until now, guide dogs have been one of the main tools to provide some freedom to this group of people. And it is them that have inspired us to create Lisa. Lisa is endowed with all the technology required to establish routes and warn users of any problems around them, and it is always on her toes, and this is very important for blind people. For all of them, Lisa is the answer. We want to make Lisa available for free to anybody who may need it, because not everybody can look after a guide dog, but everybody should enjoy their autonomy and their freedom. So we have with us the founder of LISA. Welcome. I'm sure, well, that your people may be wondering why one needs a robot to do things that, you know, could be done by a guide dog. So what does LISA contribute to somebody who is blind? My inspiration came when I discovered that over 256 million people in the world are blind. And my father was diagnosed with a visual disease which will make him blind. So my wish is that when my father cannot see anymore, he will have LISA available to him. Not just him, but also everybody like him. So LISA will help then blind people to conquer new territories, right? Well, I would like for LISA to be a kind of legacy, providing autonomy, freedom, mobility, and dignity to people who need it. People who need those, that liberty, that freedom, that autonomy. Thank you. After LISA, we are going to Chile with SMERT. QR codes are more and more present around us. They're very useful. They offer us, well, we can use them in restaurants to look at the menu. But just imagine if we could use them to save lives. SMERT is an emergency management system which, through reading a simple QR code, takes 15 seconds to provide vital information, strategic, immediate information to emergency teams. The information provided by the code allows professionals to manage their services in a much more efficient way. And this video will explain things a little bit better. The response time is vital to save lives. When a fire team, when a fire brigade goes to an emergency, they don't know what they're going to find. How many exits are there in this building? Is there a rooftop? What materials is it made of? For intervention teams, any information is precious. In SMER, we have found a way to provide this information in record time. We want every building to have a QR code which, within 15 seconds, can provide vital and strategic information about anything that may be used to develop a practical action plan, because it is very frustrating not to be able to act in a situation when people need us. So SMERT has revolutionized the way in which we manage emergencies. Every second counts in an emergency. Well, it would be wonderful for every home or every building to have a SMERT. We have the CEO and founder of SMERT. Please join me here on the stage. Hello. Well, the muses, well, the inspiration for SMERT came about in a fire department. Well, I am a civil engineer by profession, but I'm also a fireman. Firemen are always, they're not sure whether they're not always sure whether they're going to be able to control a fire. So it is important to change the way in which emergencies managed, because sometimes it can be very frustrating not to be able to rescue a person. And so it is very important to generate a change with, you know, the technology that we have available to us in the 21st century. It's very important so that emergency teams can avail themselves of the information they need in record time. And what is the impact going to be of SMERT? Well, in order to be aware of the importance of an application like this, and you only realize the importance of this kind of system when you are immersed in an emergency, where you need to save people that cannot be saved, people who cannot just leave the building of their own accord. We believe that with our technology we can save the people who live in the more than 150 million buildings in the world, and this would help avert many problems. I'm sure that SMERT is going to save many lives in the future. Thank you. So we reached the last finalist. From Greece, we have Lat Roller. It's a mobility device designed to improve the lives of people with disabilities and their caretakers who face many social barriers and problems accessing their jobs, accessing housing. And the Lat Roller aspires to generate a positive impact and a measurable impact, making our cities and our companies much more friendly environments. Let's watch the video. Let's imagine an ideal world where there is no architectural barriers, where we feel free, where we're not afraid of being alone, a world where being independent doesn't just entail the amount of things we can do on our own. 65 million people would say that a reality like that would be impossible. This is the 65 people in the world who are on a wheelchair. In Lat Roller, we have been working to design a wheelchair that allows you to stand when you decide to stand without any help, that is able to go upstairs or go through difficult areas. And it has an affordable cost because of its engineering processes. We want to change people's lives. Looking at each other's eyes is the best way of communicating with each other. Lat Roller is for everybody. So I would like to ask the CEO and inventor of this prodigy, Dimitris Petrotas, to come on the stage.
Buenas tardes. En todos los proyectos presentados esta tarde.
Well, all the projects have revealed a lot of empathy, but what made you put yourself in the shoes of somebody with limited mobility and understand those people's needs, which go far beyond not being able to move?
The houses. I create homes for people to live in and love each other. So when a client of mine called me after a terrible car accident she had to remodel her house in order to be able to use it, I took it as a challenge. It wasn't difficult after all to remodel a house with lowering the light switches and make the bathroom accessible, and all these small changes a disabled user of a wheelchair would love to have with their homes. After this renovation, I found out that I have created a disaster for the other members of the family, who were using that house. So that was the light bulb moment for me, and I thought, what if instead of lowering everything down and making a house accessible, what we could do to make those people stand up and use not only the house, but every single place in the urban environment they live in. So after 3 years of patents, struggles, and prototypes, we were ready to make our first prototype and test it with real-world environments.
En estos años de pandemia, Dimitris,
In these years of the pandemic, we have learned the importance of being able to see people's smiles, look at people in the eyes. It's wonderful to see people without face masks. But in a project like yours, we also realized how important it is to look people in the eye. What is the impact of land roller in this context?
Shifting wheelchair is a powered standing wheelchair. It is capable to promote health, create independency, untethered mobility and social cohesion. With land roller, the users will be able to be better absorbed in the workforce. They will raise families. They will socialize better in their with families and friends. They will be able to live more healthy and long lives, and they will be meaningful, active members of the societies they need.
thank you very much. Dimitris.
Thank you.
Thank you.
Thank you.
Congratulations.
Well, so we have reached the climax of today's session. We will know who the winners are. Of course, all of us here, after having watched the videos and having listened to the protagonists, we consider everybody to be a winner, regardless of who was chosen by the jury, because all of them are making a contribution to make our world a better place. So let's give all of them, all 9 of them, a very big round of applause. Also, we consider, as I said, we consider all of them winners, but they have also received an award by IE, and their projects have been publicized in different media. And so in this way, the message has reached many, many people. And this will, of course, help their projects succeed. Our protagonists are part of the Innova Network, which is a group where innovation can be multiplied. And it is a network that integrates the winners and the finalists of previous editions. I would like to invite the Secretary General of Innovation of Spain, Teresa Riesgo, the President of the MAPFRE Foundation, Antonio Huertas, and the President of IE University, Ignacio Íñiguez.
Es un momento muy.
So this is a very moving moment for me, because, you know, I have been asked to open the envelopes. Normally, it's other people that open the envelopes, but it is going to be me now. So the winner in the category of health technology in this 5th edition of the MAPFRE Awards is, and I didn't want to open the envelopes before, so that, you know, so the winner is Anna. Ariel Silverstein will pick up the award. The winner in the Senior Economy category in this 5th edition of the MAPFRE Foundation Awards is... So I'm just trying to build up the climax. So the winner is Hubu. Eduardo Fierro will pick up the award. And the last category is prevention and mobility. Well, it's a good thing that the envelope was not sealed. The winner is Lisa. The winner is Desenin. Congratulations. So congratulations to all the winners on my own behalf and on behalf of everybody here. I'm sure that the effort was well worth it. And of course, from now on, we have to make an effort to make sure that these projects can transform the lives of thousands of people. And now I will give the floor to the Secretary General of Innovation, Teresa Riesgo. Thank you, Teresa. You can have my own microphone if you like. Well, thank you very much. I just want to say hello to those of you who have participated in these awards. Of course, to the winners, but I think that all of you can consider yourselves to be winners. And so these projects are all wonderful, and the main conclusion is that all of these projects can have a huge impact. I want to congratulate the MAPFRE Foundation because this work that they're doing is very important. It is very important for us to start talking about important things, relevant things, things that are essential, which are the ones that can change our lives. And social innovation is something that can change the world. On the one hand, because innovation, and I'm Secretary General for Innovation, and I couldn't say anything different. Of course, I'm not going to say that innovation is good for nothing. Innovation is essential. And we should understand innovation, this is something that is particularly relevant today. Innovation is something that requires to do something new, right? And it should be based on knowledge. It doesn't have to be scientific knowledge, because today we have seen, and I want to apologize to my colleagues, but sometimes there's a kind of knowledge which is even more important than scientific knowledge, which is the knowledge based on problem identification. But innovation is not just something new that is based on knowledge, but it is also something that needs to generate a benefit. It doesn't have to be an economic benefit, because precisely what it should generate is an impact. And what we have seen today is projects It is not project, it is realities with a purpose and with a motivation that all the different finalists have discussed. And for me, all of you are an example, and we should all follow your example, because the president of MAPFRE was saying, sometimes we see entrepreneurs as young people who are like nerds with their computers, always trying to do more and more things, but sometimes this is not entrepreneurship. Entrepreneurship is something that's much more self-denying, because life is not always, I'm going to change jobs because I'm going to make more money. Sometimes you may decide to change jobs because you found something with a purpose, something that is going to make you happier. And that happiness is something we should all aim for. But in addition, I am an engineer and I like technology. I like technology very much. And technology, it's wonderful that technology can be used for things that, like the ones we have seen here today. We have seen robots, we have seen brain interfaces, we have seen natural language processing, artificial intelligence, advanced mechanics in the last example. So all of that requires studying, knowledge, it requires lots of analyses. And lastly, I would like to mention something that is also very important, which is the presence of women in this type of entrepreneurial projects, because technological entrepreneurship, normally it's not easy to find projects that are led by women, in spite of the fact that women account for 50% of the population. So if we want to be innovative and if we want to generate societies based on innovation, this is an area where women need to play a very important role. So the only thing I want to say to conclude is that we will not go very far if we go on our own. We need to go all together. And I'm sure that many of you have had to forge alliances with lots of people. An architect that has to partner with a mechanic, or somebody who has to build a robot for visually challenged people. So this is not easy. So the first thing I want to say is that this logo we have been seeing all evening today, this image of the MAPFRE Foundation, I think is fundamental. Those interconnected dots which mean that all of us need one another. The foundation needs you. You probably need some experts, technologists, or angels that may finance your project. And all of that we need to do it together. And you can count on us. We are the government, and the public administration is part of that helix where we need to work all together. We are part of it also by providing funding of these projects and facilitating and making it easier for those projects to be implemented. So congratulations to everybody, to the foundation, to those of you here. And I want to tell you that you shouldn't lose heart, because in this world, in the world of innovation, and particularly, if you want to improve people's lives, you need to keep rowing. If you stop rowing, your boat will not move forward. So thank you all very much, and congratulations to the winners. So, thank you very much. Thank you very much, Teresa. I'm going to ask everybody to come up to the stage so that we can have a family picture taken. Antonio, Ignacio Baeza, Julio Domingo, Director General of the Foundation, our winners, and the finalists as well, so that we can have a family photo taken.
importante es que os coloquéis ahí. Bueno, piden por favor que un instante se queden solo los ganadores. Se queden solo los ganadores para la foto.
Please, just a picture just with the winners, please. Now we're going to shoot a video. It's going to be something very short. Just smile, please. It's not just a photograph, but also a video. Now, just the winners, please. And then we will adjourn.
Un instante. Bueno, aquí tenemos a los tres ganadores merecidísimos.
So these are the three winners. They really deserve their award. So with these videos and with the three winners on the stage, our event has come to an end. Thank you all very much for supporting with your presence such caring, intelligent and innovative people. I just want to say, and afterwards there's going to be a cocktail in the lobby, but I just want to remind you of something very interesting. You need to give back your headsets to the hostesses outside. You can keep your headsets, but what you really want to give back is the actual translation device. Thank you.